Greetings, I'm Sunil Mankad, Associate Professor of Medicine at Mayo Clinic. During today's commentary, we'll be discussing choosing wisely in critical care. I'm joined by my colleague, Dr. Greg Barsness, who's Director of our Cardiac Intensive Care Unit here at Mayo Clinic. Welcome, Greg. So tell us a little bit about the Choosing Wisely campaign. What exactly is it, and why is it important?
Sure. Well, thank you for, first of all, allowing me to participate in this conversation. The Choosing Wisely campaign is something that's been initiated over the last several years, really since 2012. It was envisioned in 2010, started up as a real campaign in 2012, and involves a variety of professional societies, medical societies, who've gotten together to distribute lists of 5 things that are perhaps less meaningful or less important to practice and perhaps even harmful. It's been shown, as you know, that about 30% of current medical practice patterns in the U.S. are either not helpful or even potentially harmful. So that's a huge amount of our scarce medical care resources that are put forth towards something that really has no real benefit and maybe even harm to patient care. So it's in that context that the critical care societies, a collaborative group of various critical care societies, got together and put together, from a vast list of potential candidate options, got 5 items on a list of things that you should probably avoid doing as routine parts of critical care medicine.
That's great. And what are some of the specific goals of this initiative?
So the stated goal of the Choosing Wisely campaign is to develop to spark a conversation between providers amongst themselves, as well as providers and patients and families, to give a framework so that we can discuss really what is appropriate and what might not be appropriate in the care of these patients. And to that extent, really the emphasis has grown, and people have a variety of collaborations and societies have put together these efforts, about 60 now.
That's great. And you mentioned it's grown. How widely recognized or utilized is this campaign?
Well, that's an important point, because if nobody knows about it, it's not particularly useful. But in talking about this over the last several years, I've taken informal polls in a variety of settings, from primary care practitioners to critical care people, and the awareness is growing, but it's certainly not 100%. So whereas there was just, back in 2012, there was just a smattering of people who had any idea there was such a program, now a good half of the audience often knows what the program is and that it's available.
And you mentioned some large organizations that are taking part in it. What are some of the specific ones that people might know?
The American College of Cardiology has a list. The rheumatology societies, infectious disease, really all of the major medical societies have gotten together, and again, there's almost 70 now of these lists that have been put together by the organizations.
Yeah, and I know with I am an imager, and the American Society of Echocardiography has certainly become involved to make sure that the echocardiograms you order are appropriate in that regard.
Yes.
So really this is about quality. Have we been able to impact quality and made an actual difference in patient satisfaction?
Isn't that great? So that would be the goal, right? To decrease costs, improve quality, improve outcome. That is the goal. And I would have to say that although this has engendered some discussion, this whole campaign, data about actual impact is less clear. So we don't have data about outcome measures or specific, really scientific data about these, but I would say that awareness is increasing. These are processes that large groups of experts have agreed wholeheartedly are not necessarily appropriate as part of routine care, and in that way I think it's had an impact. And it's actually had a global impact. So although this started with the ABIM and a US-centered effort, there are now European societies, Canadian societies, also doing the same sort of campaign. So it's really had a global reach.
And you mentioned the Choosing Wisely campaign targets practices that are to be avoided for the most part. But does it also encourage certain practices that have been established to improve quality?
You know, I can't speak to all of the lists, but these are generally lists of 5 things to be avoided in practice. And so I think that that's a natural next step, though. I think assessing the outcome, the impact of these steps initially, and then going forward to add some things that ought to be routine. You know, we already have guidelines that suggest that you should do this or that. This is meant to really take the place of that gap that was present where, you know, you might think about doing this, but there's no list anywhere that says you probably shouldn't. Now we have that, but incorporating some things that are a good idea you might think about, but putting some kind of qualitative emphasis on those things that you should do would also be important.
Yeah, no, I think that's great, and you know, ultimately it's about quality and value, and respecting both the patient and the institution's practices.
Agreed.
Well, thanks, Greg, for these very important insights, and thanks to our viewers for tuning in to Mayo Clinic's commentary at heart.org on Medscape.